Welcome to the CareSmarts 360 podcast. I'm Mike Palladino, a senior account executive here at CareSmarts. Digital communities offer a wealth of opportunities to revolutionize home care. Imagine a platform connecting seniors with caregivers and healthcare providers. Seniors can access educational resources, participate in support groups, and even remotely monitor vital signs. Caregivers can find respite services, share best practices, and receive real-time updates from healthcare professionals. This fosters a sense of community, reducing isolation and also empowering everybody involved. However, challenges do remain. Digital literacy varies greatly, and some seniors may lack the technology or internet access to participate in these programs. Data security and privacy must be rigorously addressed as well. Further, integrating digital tools with existing workflows requires careful planning and investment. Despite these hurdles, the potential of digital communities in home care is undeniable. By embracing technology and fostering collaboration, we can create a more connected, informed, and empowered home care experience for all. Today, we have Christina Keys on the panel, who is the founder of Keys for Caregiving that connects businesses, organizations, and family caregivers to collectively transform the care space community and amplify their voice for change. Welcome to the podcast, Christina.
Thanks for having me, Mike.
Yeah, awesome. We're very excited. As you can tell, it's a very important topic and one that we feel very passionately about. And also we're, again, excited to hear your expertise on such a profound topic that definitely needs, attention today. And I think the technology aspect of it is really what I see as one of the bigger challenges that we face in this area today. So with that said, Christina, I have a series of questions I'd like to ask you today to really, again, help our audience understand, how to overcome some of these challenges and really lean on your expertise to, provide guidance in such a hot topic of conversation, if you will. So, Christina, the first question I have for you, what are the biggest challenges caregivers face today, and how can we, as a society, better address them?
Well, I think some of the biggest challenges caregivers face is not having enough support.
Hmm.
And a lot of times they're thrown into those roles without any training. And for myself, when I was thrown into being a caregiver, I was a career woman, walked into a hospital, and I walked out of that hospital no longer a career woman, but a family caregiver, and walked into the role of being a med manager, a CNA, a physical therapist, occupational therapist, nurse, doctor, whatever, when she was between visits.
Hmm.
And I wasn't aware of all the different support groups. I wasn't made aware of all the different resources. And in talking to family caregivers all across the United States, that's one of the biggest challenges they have is where do I find resources? How do I find support? And I feel so alone. And we really aren't. There's so many of us out
Oh
there.
yeah. Yeah, it's something that can be pretty scary, right? And I think, oftentimes it comes when you least expect it, and you obviously want to do the best you can to be there for your loved one or those that ultimately need that family caregiving, component. So it's very admirable, of course. Myself and my family, we've had to kind of go through something similar where, it's a bit of a different situation likely, but I have an elderly, grandparent. He's 96 years old. We tried to set him up with home care agencies. He actually did have some success with that, but no one was able to provide the care that he truly needed other than his family. So my father and his brothers and sister really have now taken on that ownership of caregiving, and it is tough when you have somebody who wants to age in place. That just doesn't want to go into a home, wants to be sorry, I should say, of a facility. I should mention, but it wants to stay in his home that he's lived in for 55 years,
Right.
right? So it's important to them, and they've had to really maneuver somebody who's challenging to manage. Right? Love my grandfather; he's a lovely man. he's just very stubborn. He's an Italian, straight
Yeah,
off the boat kind of guy, and he immigrated here, and they're very stuck in their ways. They like what they like. They like what they like. They want what they want.
right,
So it's managing that and really figuring out how to best manage them and allow them to be comfortable, I think is as the main thing at the end of the day too, right? So
right, absolutely.
it's a very challenging gig, but as you mentioned, you can feel alone, but you're definitely not. There's a lot of resources out there, and there's many people that are likely doing just that, which is being a family caregiver.
Right.
So with that said, Christina, great segue into the next question. Many caregivers feel invisible and unsupported. What are some effective ways to raise public awareness about the vital role caregivers play in society?
Well, I think one of the things that caregivers forget is that there's two people on that care journey. It's not only the people out in the world that forget that there's two people on the care journey, it's the caregivers ourselves. We forget how important we are and how important our voice is, right? And I think it's really important for caregivers to understand that their voice matters, their journey matters, and however messy it is, however confused they are, however much they know or don't know, sharing that experience is going to make other caregivers understand that this is the new normal and
Yeah,
this is okay. Because what happens for family caregivers, I don't know about your family and you, but for me, I was comparing my life before to what my
yeah,
life was as a caregiver. And so I was feeling like I was constantly failing. And once I started hearing other stories of caregivers and redefining what normal was for me, it made a huge difference in feeling like I could, take on caregiving
yeah.
and do a good job. So I think caregivers really underestimate the power of their voice and
Oh,
sharing
absolutely.
story, whether it be on social media. And it's very uncomfortable at first. I remember when I first started sharing my story, a lot of people, not a lot of people, but a few people would say, "Oh, you're just doing that for attention." And,
Wow.
after a while, I thought, yeah, I am doing it for attention. Here's whose attention I want. I want the healthcare systems that are
Yeah,
broken to pay attention.
yeah,
I want the politicians who are too busy ignoring us to pay attention. I want other caregivers who are out there feeling lost to pay attention to the fact that they're not alone, right?
yeah,
Your story matters as a family caregiver, even if it's just a story of, my God, I went through and it took me forever to find the right place where we can buy prescriptions and afford them because
yeah,
there are choices and things like that. Or where do I find adult briefs? Or how do I hire professional care or private care, right? How do I do that? If we're not speaking up and sharing our story, who else is going to tell us how to do it? Because frankly, I'm going
yeah,
to trust a caregiver who's been there and done it more than I will trust somebody who's never done it before, but they have some great ideas, you
yeah.
know? So I think that's
Absolutely.
the biggest thing I'd love caregivers to understand is, it doesn't matter if you have it all right. You're showing up for love and
Yeah,
you're showing up for care, and that means you're doing it right and your
yeah.
story matters.
I couldn't have put it any better. And I think, there's two things that you said that stood out to me. It was this is the new normal and
Mhm.
acceptance, right? I
Right.
think one thing, and I'll always leverage the story that I have personally, it's just the most relevant example that I have. But with my dad and his siblings, they at least have themselves as a support group. So
Right.
they can understand, what's worked one day, what was the attitude the next day, how's he feeling? Is he fatigued? Has he been mobile? Is he eating, right? Is he going to the bathroom? All these hard questions
Right.
sometimes that you don't want to ask, but no, they at least have themselves to kind of lean on and figure out how to get them to do certain things. That's not always the case, and it's not always I guess you could say that easy. It was
Right.
challenging, but now I think they have a good system in place. But I think that the main thing that's relevant about that story is communicating and asking questions and being
Right.
curious and also recognizing that if you're experiencing something, there's I guarantee somebody else is also experiencing something similar. So to your point, it's using your voice. It's leveraging your local resources, if any, right? I know that's obviously a hot topic, and there's largely scarce resources given to to our industry and to our line of work. But I think it's being an advocate. It's showing up to town halls. It's going to conferences. It's going to events and really advocating for the need that we have in this industry. And I think
Right.
it's getting better a bit over time. It's a long way to go, but I think there's been a bit of a shift over the last couple of years, at least, with regard to programs being put in place, some more funding, depending on where you are, obviously. Certain states do it better than others. And I think the other thing is technology and how technology is helping bridge that gap and helping onboard new caregivers, helping train them, and giving them also an outlet to communicate with others. Even if it's like a Facebook group, people
Right.
experiencing something similar. Those things matter, and people sometimes want to just log in and tell their story in a comfort of their home. So I think that's
Right.
something that also has a good impact.
For sure.
Yeah, amazing. So I know we've already kind of talked about this loosely, but the next question I wanted to ask you, Christina, revolves around family dynamics, which can be complex, especially in caregiving situations.
Yes.
What
Yes.
resources or support systems can be offered to help families navigate these challenges?
Well, I think that, first of all, I would suggest that any family caregiver finds a support group. Peer-to-peer support is super important. And if you can't find a support group, some of the ways you can find a support group is, you can call the hotline at Caregiver Action Network. You can certainly check with some of your local area agencies on aging. You can certainly check with some of the senior centers. Amazingly enough, even adult protective services, I know that's a scary word for some family
Yeah,
caregivers, know about some, support groups as well. But being able to talk to other peers is going to help. And there are also great, wonderful folks that are care coaches who actually act as mediators when it comes to family, because there's typically, there's one primary family caregiver who's doing it. And
mhm,
there's, a couple of other people in the family who have various opinions on how it should be done, right?
yeah,
Not everybody can be there. There are physical distances that challenges that people have to overcome as well. So I think the biggest thing is having that communication with as much as you can and being okay with it's going to be difficult. It's going to be difficult if you don't talk to that, other family member who's not participating, or if you do talk to them, right? It's going to be uncomfortable either way. And so, really, if you're a family caregiver, your first thing you need to be looking out for is the person you're caring for.
yeah,
So, you have to show up for those uncomfortable moments. So, you have to choose your uncomfortable. And if you're uncomfortable is I'm going to talk to my brother who doesn't want to be involved but has all kinds of opinions, but he needs to know here's why it's a priority.
yeah,
Because for instance, in my situation, I didn't have a lot of help from my other family members, but I had a mother who really wanted those other family members in her life.
mhm,
And if I wanted to provide her the best care, that meant that I had to take care of somehow finding a way to address her emotional needs too. And her having those family members was part of that, right?
yeah,
So although I might have not have got the support I needed, I was able to at times help my mother get the emotional, support she needed, which was even if it was just a phone call from them.
yeah,
So again, those conversations can be very difficult. It's okay if you need to cry. It's okay if you need to write a letter. If you don't know how to, do face to face, if you don't have a good relationship with those family members, it's okay to do conference calls with the person that you're caring for. It's okay to just send updates. Just send updates. This is what's going on and include the person you're caring for if you can, if they are, have the cognitive ability to be there for those, right?
yeah,
So it's difficult, right? But it's another one of those situations as a family caregiver where you really have to choose your uncomfortable. And you're uncomfortable, the priority in that has to be, is it going to help the person you're caring for in the long run? Right? Either emotionally, physically, mentally, financially, or spiritually.
yeah,
Whatever is going to get them to be a little bit more comfortable is what you have to do. And then what you get to do as a family caregiver, because you matter, you need to take care of yourself.
yeah,
If you take those uncomfortable feelings, all those yucky feelings from having to talk to that family member who doesn't support you or who isn't on the same page as you, or the person you're caring for constantly asking and you're having to say they aren't showing up. How you take care of yourself is you do what you need to do, you show up for those uncomfortable moments, you choose your uncomfortable, and then you take a step back and you go to one of those support groups. And whether that support group is Zoom or in person or even just a Facebook group or social media group that you're part of. And you either, share about it there or listen to other people sharing about it so you don't feel so alone. Because
Yeah.
literally, there is at least hundreds of family caregivers going through the exact same situation you are going through today. And they're trying to just get through it just the way you are.
Oh yeah, absolutely. And I think the hardest thing that we typically see, and this is both through our line of work and also just through the conferences I've gone to, the people I've spoken to, and also through my family, it's understanding what's most important to the person receiving the care, right? If they're able to present that. And sometimes they aren't, right, depending on their situation. But in your case, you mentioned that, your mother wanted the support emotionally of the family or to see the family, right? And I think that's something that is important to figure out how you can navigate that. It's not always easy. Sometimes there's challenging family dynamics. We've seen that
Yes,
time and time
very
again, right? But it's really just kind of navigating as best you can how to make that person feel heard, how to
much.
make them feel comfortable, because we've all seen the statistics. The person that's receiving the care, if they're comfortable, if they're familiar with the people that are providing the care, whether it's a family member or someone outside of the family, as long as they're comfortable and confident in that person's abilities to hear them and understand their needs,
Right.
the quality of care and the outcomes are way more likely to be positive. And I think the second thing on that topic that you mentioned just now is communicating to others. And it's being, taking that first step. Usually the first step is the hardest, and actually putting yourself out there, because you don't know, sometimes you just don't recognize how it's going to be received. Once you kind of get over that barrier, then you see, yes, there's so many people in my situation. It's almost like you take a deep breath, you can kind of breathe,
Right.
right? And it's almost like it's a relief. But it kind of feels like a weight is lifted off of you, and you can say, okay, you know what? There's others that are going through this. They're overcoming it and they're actually crushing it. Now, in terms of providing the care, I can do it too. And then that's how you start to build that confidence on your own, because you have to have your own self-confidence to give those that you're caring for know the quality of care that they deserve, right? Because you always want to be empathetic, put yourself in their shoes and say,
Right.
how would I want to be treated? What would I want if I was them? And trying to do that to the best of your ability.
And that's why those support groups, those peer-to-peer support groups, again, whether they be in person via Zoom or even just a Facebook or social media group, are so important. Because I think we all know when we're caregiving, it does affect our self-esteem. Because no matter
Absolutely.
how good of a caregiver I am, no matter how good of a caregiver I was for my mother for that 10 years, she still had medical issues that I couldn't magically solve, right?
Yep.
And that's hard on us, right? Because we love this person, we're caring for this person, and we want them to get better, and they're just not getting cured, right? And even
Yeah.
though logically we know that, emotionally it's really tough for us. So, those support groups are really, really, really important for us. So,
Yeah, and like you said, it feels like you're kind of fighting an uphill battle, because you
right,
want them to get, if they're not improving or if they're kind of stagnant, sometimes stagnant is a good thing, right? They're not
right,
getting worse. That's kind of, in our terms, that's kind of what you want, depending on the situation, obviously. But there's it's almost like a mental thing where you're trying to overcome the idea that like all this work I'm doing isn't resulting in anything, or
yeah,
it's like you've taken time out of your career or other aspects of your life to then focus on this part of it. So it's like you feel like you're kind of losing one thing and then the other thing isn't getting better. But what we fail to recognize when in that context is the impact that you're having and the work you're doing. While you might not see the tangible results of that, it is making a difference, and
oh
it is
yeah,
prolonging that person's life or giving them a quality of life they deserve. And I think, through those peer-to-peer groups, like you mentioned, it's a lot easier to see that when you see the perspective of somebody else and have the impact that they've made on their loved one or the person they're caring for, right? So I think it's just being open, it's being honest with yourself and with others, and just allowing yourself to kind of be vulnerable a little bit, right? And I think that's how you really kind of level up in that regard of caregiving.
yeah. And I love talking to caregivers. I get a lot of call from caregivers all over the United States,
Hmm.
and I'm very open about giving people my phone number and especially caregivers, right? And they call me and they talk about how they're failing, and I listen for a little bit and I say, well, let me tell you this story about this caregiver that I know. And I start sharing about their story. I'm like,
Hmm.
you know, if you heard somebody tell you that story about all the things you've done and all the things you step up to do and all the challenges you've faced, and you're still showing up all in the name of love, wouldn't you just think that person's incredible?
Yeah.
Do you realize who you are and what you've done and what you're accomplishing, all in the name of love?
Yeah.
And so I like to take a minute to remind them that although in their mind they might feel like they're failing, they're really going beyond anything they've ever known before, anybody they've ever been before, and loving on a completely different level than they've ever loved before.
Yeah.
And frankly, them finding that support too, is going to make them be able to be a better caregiver to the person that they love. And in my journey, that first 3 years, I didn't have support. I didn't know resources. I didn't know any of that. And 3 years in, when I had to leave my career, I went to my last doctor's appointment and, they said, hey, your body's literally shutting down. You're sleeping maybe 5 to 10 hours a week.
Yeah.
Well, you probably won't even live 6 months. I mean, they told me I had like 6 months to live, right? And so I had to practice that, awful thing, self-care, right? And I did, and amazingly enough, I was holding on to my mother so tight during that 3 years because I was so afraid she was going to die that there was no room for me. There was
Hmm.
no room for I didn't exist, right? And
Yeah.
when the doctors told me that, and I had to start practicing that self-care, and I had to start seeking support from other caregivers and hearing other stories, what happened for me is not only did I give myself a second chance at life, right? But I was able to become a much better caregiver for my mother because I was happier, you
Yeah.
know?
It makes a big difference, and it's an amazing story you've just
Hmm.
shared, obviously, and it kind of amplifies the challenges that family caregivers face. And there's also it's hard to kind of recognize the moment that you're in unless you kind of take a step back and objectively look at where you're at today and what things are looking like. And I think sometimes you need a bit of a wake up call to say, hey, you know what? If you continue on this path, these are the outcomes possibly. But it's just recognizing that, to be the best caregiver, it's the self-care aspect. If you can take amazing care, at least of yourself, in the frame of mind you need to be in, that reflects in your work. And you could probably say that about most industries, most
Yeah,
jobs, but I think when you put that into the context of caregiving, you have to be able to put your best foot forward, but also recognize that you matter. You have to take care of yourself too.
absolutely.
And we see the best caregivers are the ones that are usually practicing that as best as they can.
Absolutely. And, take a minute as a caregiver, we need to redefine what self-care is,
Yeah.
I mean, self-care was different when I was caregiving than it was when I was making 100 grand a year, right? I was
Hmm.
vacationing, reading by the, pool, all this other
Yep.
stuff. And then suddenly, when I had to redefine self-care, it was, I'm just going to take a blood pressure pill and text my friend I took it,
Yeah.
and that
Yeah.
30 seconds was self-care, right? I had to
Hmm.
completely redefine it.
Yeah.
So because I was angry and sad that I couldn't do the things I used to do, and I couldn't afford the things, whether it be time or money, that
Hmm.
I used to do for self-care. So in allowing myself to redefine that normal, I gave myself and my mother a gift.
Yeah. Absolutely. And yeah, I think it's just kind of recognizing we are where we are and adjusting. And I think the word that I like to use, it's a word I use almost every day. It's adaptability. It's adapting to that new normal. And I
Right.
think once you realize that, you'll see a shift, like almost like it's almost like scientific. It's like you see a
Right.
shift
Right.
and all the outcomes, right? And I think that's something
Sure.
that is miraculous, truly. All right, Christina, two more questions for you today.
Okay.
And the second to last question really revolves around the workplace. And, the workplace often doesn't accommodate caregiver needs as best we think it should. So, what are some policy changes or initiatives that employers can implement to better support their caregiver employees?
Well, I do need to, you know, say a lot of employers have started to bring programs into their EAP solutions and into the workplace that do support caregivers, right? A lot of them have stepped up and done that. And I think that every employer should do that
Hmm.
because you're looking at anywhere from 17 to 23% of your workforce are caregivers. And if you're
Yeah.
adding in people who are caring for children too, you're up to 40%.
Yep.
Right. So if you want to have less turnover, if you want to have better productivity, you definitely want to bring something in, whether it be whatever program it is, well, the caregiving.com, whatever it is, right? There are some great programs out there. But one of the places that I think that they fall short is that they'll implement these programs. I worked for this amazing company, right? They didn't, back in 2017, they didn't have, anything like this before the pandemic, really. It was during the pandemic that people started really, really talking about, family caregivers, because people had to step up in ways they never had before, right?
Hmm.
So before the pandemic, there wasn't a lot of stuff out there, right, for family caregivers. And when I went back to that company to talk to them, to engage on a different level with them, I asked one of the workers there, I said, "Did you guys finally get something to support your family caregivers?" And he said, "Oh, because he mentioned that he wasn't at the home office anymore, he was at a different office." He said, I think they have something, like they told us about it when I first started there, but this was 3 years later and he's
Right.
not hearing about it. So why are we not, because we're all getting those letters from our companies and HR updates and all these other, why are we not being reminded in those letters that, hey, if you've become a family caregiver over the weekend, because sometimes that's all it takes is a weekend. When there
Yeah.
was a Saturday morning that my mom was an independent woman laying hardwood floors in her house, I was playing on 3 softball teams. That was at 10 o'clock in the morning. By 3:42 p.m., she needed care and I became a caregiver, right? We didn't know, right?
Yeah.
They need to be sharing that those programs are there. They need to be having people come in and doing things like lunch and learns quarterly or at least once a year to say, hey, if you're a caregiver, if you're trying to balance work and life and caring for another person, this is how you can do it. This is what you can do here. This is what you can do in your own town. They can also offer, there are many large companies that offer a place for people to have, sometimes they'll have 12-step meetings, so sometimes they'll have other support groups and things like that.
Yeah.
Why could they not have, a once a week lunchtime caregiver support group? Because
Yeah.
if you're looking at a company that has 500, plus people, or even 100 plus people, and you're looking at it being 17 to 23% of the staff, you're going to have people
Oh
showing.
yeah. A
And if
large
it,
cohort, right, of
right,
people that are going to
exactly.
be needing these services. And sorry to cut you off, but it's something that I think is super relevant, right? I think in a lot of, thankfully, my organization now, CareSmarts, we obviously think about these things. So we do have great support programs, but I would say had a pretty long career, over 10 years in software and sales and technology.
Right,
Not one company has ever put that at the forefront. And I think now maybe that's changing a bit.
right,
But when you look at the stats, like you said, 17 to 23%, if you're in a company of 1,000 plus people, that's over 170
right,
employees
right.
that likely have to go through something like this or experiencing something like this. And that's tough. And it's almost something that's like, if it's out of sight, it's out of mind, we're not thinking about it. But the reality is, this is people's lives every single day, whereas they have the stress of their job. If they're able to still work their job, that is, then they have to go home or take a break from lunch or like, drive around during their workday if they're on the road
Right.
and support those family members. Or if it's not physically, being there for them, it's financially supporting them, which is another burden sometimes people take on,
Right,
right? And
absolutely.
I shouldn't say burden, but it kind of, you can kind of put it in that category, whereas you have to then work more hours, get a second
Right,
job, and that's kind of what goes on, right? And again, I'm thankful that where we're at here with Care Smarts, we do have these amazing support programs for our leadership. Um, but it's few and far between. I haven't really seen much of it elsewhere. And again,
right.
times are kind of changing now, I guess. But I would love to see more of an effort or emphasis put from organizations from the top down, like you've mentioned, where it's even like a weekly newsletter or, hey, FYI, if you're going through something like this, check out these resources we've put together to really let that employee know that they're cared for. And I think that's what people want, right?
Literally once a month, even if you highlighted once a month one of the resources that are there, or even something as simple as having a quiet room in your office that
Yeah.
people can go and do a call if they need to do a call with a doctor rather than trying to be in the break room where everybody's around. They're talking about their family,
Personal stuff,
medical.
right?
Exactly.
Exactly. Yeah.
It's just not that difficult. And the money that companies are going to save in turnover, because a lot of those employees are really, really hardworking,
Yeah.
and they've been there a long time, and caregiving just happened. So you
Yeah.
either pay for turnover, or you take some money and you invest it in something that's in your HR stack that's
Yeah.
going to be able to help those family caregivers, right?
Yeah, and it's a good point, right? Because I think what often happens is companies don't recognize the actual cost of a new employee or cost of somebody leaving. Or if you're a tenured employee, even if you've been there for like a year or two, you're at that point becoming an SME, or you've learned a lot about the company, you understand the product or the service or whatever it is you provide, right? And if life happens and things need to be shifted, or you have to kind of align your priorities differently to the point where in some cases you have to leave your work or job if you're not being supported with those new life changes. All they had to do is just put a little bit of money into those employee programs rather than having to go through the efforts of retraining somebody. Probably if you're getting a new person in that role, the average salary or the pay for that role probably increased, right? So you're going to be having to pay somebody more for less. And it's a simple fix, really. It is in my mind and likely in your mind, but it's something that I hope more businesses and corporations can emphasize, because if you take care of the employee, they'll take care of you, right, as a business.
Absolutely, absolutely,
Mhm.
absolutely. I just remember I had to keep it a secret, not because the company made me keep it a secret, but I felt so much shame that I was
Yeah.
going through that. And it was interesting how, my company even found out about me being a family caregiver. We had to do a GoFundMe because we couldn't afford care, and we couldn't afford, because obviously Medicare doesn't pay for that. We couldn't afford things like, adult briefs or anything. We had tapped through my mother's and my 401k, our life savings. And I'm paying anywhere from $1,500 $3,000 a month. And so I put that on. And at that time, my social media was very, very, very private. So I don't even know how this happened. But one of my customers on the East Coast happened, somebody shared it,
Wow.
and my customer called me and he says, Christina, and it was one of my top customers. Like, I was making my quota each month from this guy, right?
Yeah.
This is the last person I wanted to find out, right? And he calls me and he says, Christina, I just saw this thing. He's like, are you caring for your mother? I'm like, yeah. And he's like, I had no idea. You're always so positive and everything. And he called my CEO and said, do you know that one of your employees is struggling in this way? And like the whole management team like approached me and they're like, how can we support you? And this is
Wow.
before we even had things like, the programs that we have today. How can we support you? How can we be there for you? I mean, they were absolutely fabulous. And if I would have known, that kind of support and care, and they actually cared about their employee, that I mean, it was incredible to feel that. And imagine if employees felt that way, if they felt, I mean, the
Yeah.
dedication they would give, because these are ride or die people. Caregivers are
Yeah.
ride or die people. So they're going to
Absolutely.
be there for your company and give 150% if you're taking care of them.
Yeah, and you know what? I think one of the things you just mentioned there that stood out to me was almost feeling like you're isolated, right?
Right.
Whereas you have to keep it a secret, and then that's just another kind of self-inflicted burden you're having to manage and deal with, and then you have a stress at work or other life stress, plus the things you're keeping in, and again, it all reflects the self-care. It ultimately is very damaging to
Right.
us individually and inside. When we can't be honest about these things. And it's funny. I have a lot of these podcasts. I do a lot of these types of interviews, if you call them that. And the number one thing that I think is synonymous with every conversation that I have, it's communication and
Right.
being open and allowing yourself to be vulnerable. And I think it's a lot, believe me, it's a lot easier, as you know, it's a lot easier said than done.
Right.
But
Right.
once you can overcome that kind of stigma behind it, that's when you truly feel that relief and you truly feel the support of those around you, right? So I
Right.
think there's a lot to it. It's look, it's a difficult thing to be doing, but I think what we'll emphasize is the resources are there if you're looking for them, and if you put yourself out there, and it's those peer-to-peer groups, as you mentioned, that are really gonna be that first step to finding out what that new normal looks like for you.
Absolutely.
Yeah. Well, Christina, the last question I have for you today, this has been a fantastic conversation. I really appreciate your thoughts and your input so far. The last one that I have, hopefully ending off on a positive note here, is what are some success stories you've seen in terms of creating a more positive and also supportive caregiver culture?
Well, I think one of the biggest things I've seen with my travels across the US, and being able to see different companies come together and work together is one of the things I was most excited about, right? Kind of companies, I understand the need for competition. I understand we all need to be profitable,
Yeah,
but what we have to understand too is there's 53 million plus family caregivers out there that are struggling, that are taking care of loved ones, right? And the mortality rates for family caregivers are, I think 30% of them pass before the person they're caring for, 35% of them pass within 5 years, the person they're caring for. And if they're over 70, 65% of them pass for the person they're caring for. So I feel like in my travels across the United States, I found a lot of companies were able to say, hey, we might be doing the same thing, but there's enough business for all of us. And we need to
yeah,
support these people in our communities. And I don't think caregivers understand. And what I want to say to caregivers is there are a lot of people in your community who want to support you and be there for you. There are a lot of amazing companies and individuals that are going to be there to support you. And they've actually been through what you're going through.
right.
They either have cared for a loved one or they are caring for a loved one. So, and also, they're very good about if you call them and say, because you need their services, if you just ask this question, do you know any other resources in town that might be beneficial for me and the person I'm caring for? Ask that question to every single resource you call, and they'll share with you one or two other ones. And that's how you're going to be able to build your network. So I think that's something that's really helping to build community. That's one of the biggest changes is that people are really saying, hey, we got to work together because we can't sit around and wait for the government to fix this. Like
No,
it's kind of
absolutely
one of those
not.
like, fine, I'll do it myself moments, right? But it's all about
Yeah.
coming together and say, we're going to do this. We're going to step up and make this change. And I'm so grateful that it's not just the family caregivers using their voice, but it's all the companies that are coming together to say, hey, we really want to make a difference and we really want to show these families that we care for them and we're going to walk with them on this journey.
Yeah. Yeah, beautifully said. And I couldn't agree more with a lot of that sentiment. And I think, looking back on this whole conversation, what we again want to emphasize is that you're not alone out there, right? You're not on an island, and there is resources out there. And I think, as you mentioned, I think it's a sticking point that I have personally, but it is something we have to overcome. It's we can't wait around for, unfortunately, our governments to help us. We have to kind of, take the bull by the horns and almost do it ourselves. And these are the conversations I've had a lot of the times too with similar influencers in the space is the more of us that are advocating, the more of us that are making noise and kind of, putting this at the forefront, well, the truth is, the more likely it is that someone's going to listen. And we have started to see that. There's a lot of advocate groups, a lot of associations out there, the Home Care Association of America, for example, and they do a lot of amazing work to the point where, no, they're loud. They are asking for things. And we have started to see that move the needle. It's not moving too quickly, but it's moving in the right direction. And that is something that we need. And I think, there was a stat, I forget the actual specifics of the stat, but it was something about how obviously the baby boomer generation now, there's going to be an influx of need for caregiver support. And that's what we're now thinking about technology to help support, because the truth is the amount of baby boomers that there are, well, this number is rising, but the amount of caregivers is getting less, right? And there's many different challenges there. It's pay, right? Pay is a big one. I've seen when we're talking Medicaid, right? We work with a lot of agencies that do Medicaid and compliance and electronic visit verification as a need, right? So that's part of the services that we offer. But because we work and are compliant in every state that's considered an open state for outside software, what we hear a lot of the time now, especially, I'm not going to name the states, but there's a few states that pay like really low from a
Mhm.
reimbursement level, right? And
Right.
to the point where caregivers, as we all know, it's a very difficult job. Often it's referred to as a very thankless job, right? Because you're
Right.
doing a lot of work that it's hard, and it's a lot of times physically hard. It could be, whether you're lifting somebody or you're working with somebody that's combative or that's incontinent, or maybe they wander, they're abusive. There's so many different variations and variables we're going to possibly deal with in this industry. Way too many to name. But people are now recognizing that it's like, okay, I could either do this job for $15 an hour, or I can go work at McDonald's for $16.5 an hour. So it's like,
17, yes.
right. So I may just go work at a fast food restaurant or something like in the service industry, or the food industry, because it's going to pay me honestly slightly more, and I don't have to deal with sometimes the abuse that comes with being a caregiver, right?
Yeah.
There's different nuance with the service industry, obviously, but I think those are the challenges we're trying to solve for. So when we're talking about the baby boomer generation, there's going to be a lot more need for caregiving. This is where technology is coming in and helping
Yeah.
people age in place and giving the current caregiver ecosystem better tools to do their jobs better or to support their families better. And I think that's what excites me, honestly. And just to give you a bit of a reason why, of course, I talked to you about my grandfather, who, of course, needs that round the clock care now. But my mom was a nurse for 35 years. She's retired now, thankfully. She's unretired and retired like 5 times now, as is the running joke with nurses. But she worked and managed a home care agency, worked with and managed a home care agency for 30 plus years of her career. And I saw the challenge in what it looked like through my childhood and her managing everything, right? And it's only gotten more difficult. Technology's bridged the gap, but I think we're probably still lagging behind 5 to 8 years of where technology should be in our industry compared to other industries. Because you're talking AI, you're talking all these other, like, self-service things. And it's like, I hope that we can get there soon, because that's going to alleviate, it's not going to solve it, but it's going to alleviate a lot of the stresses that caregivers are experiencing today, whether they're working for an agency or providing family care.
Right. Yeah. And I talk about that a lot. I talk about technology being the other caregiver, you
Yeah,
know, whether it be
absolutely.
security systems, keyless entry, whether it be software programs, whether, whatever it may be, you know,
Wearables is a big one too, right? Whereas just
exactly.
the data you can get from somebody falling, or it's the quick time to response, right? And that's actually saved lives more than we can even think about now. We've seen the stats on that. It's remarkable, but again, it's slow moving, right, in terms of the development of it.
Well, I had a situation. I was traveling. I was in Austin, Texas. I live in Vancouver, Washington. We had gotten a wearable for my mother, right? And she had fought it forever. We had one forever.
Hmm.
She made it go away, whatever. I finally convinced her to get another one.
Yeah,
And she had a period during the day where she had 4 hours where she was by herself because she loved her independence, right?
yeah.
Well, during that 4 hours, I get a call. I'm in Austin, Texas, and it's my mother, and I can hear her choking on the phone. And I can't call 911 from Austin and get them there. And she doesn't have a caregiver there. And so I'm freaking out. I'm trying to I text the caregivers that, and none of them are responding. And so I remember, not only does she have the wearable, but we have home security cameras, one in a room that I can talk through, because I tried to call her back. She had hung up.
Hmm.
You only have like 6 minutes when somebody's choking, right?
Yeah.
My mom's case, we did. So I got on the cameras on my phone and yelled, I'm like, Mom, push your button, right? And so she push her button on your wrist. She pushed her button, and they had everything programmed in, how to get into the door, all of this other stuff, the address, everything. So from Austin, Texas, I was able to save
Wow.
my mom's life because we had home security cameras that had two-way intercom systems on, and she had a wearable. And if those would have not been in place, my mom, her life would have been shortened so much. So technology can definitely be like the
A
other
game changer.
caregiver, right?
Yeah. Oh,
So
absolutely. That's an amazing story. And it's definitely a feel-good story. And it really emphasizes the importance of tech. And also, like you mentioned, I haven't used this term before or coined it, but I love it. It's technology is the other
it
caregiver. And
absolutely is.
I'm
Absolutely.
gonna probably steal that from you if
You
that's
can have
okay,
it.
because
We share.
it's a wonderful way to put it. And I think the other end of that coin, and I think it's kind of the last thing I'll say about it, it's the behavior around technology, right? A
Right.
lot of the times, and generally, if you look at caregiving, and my mom was just like this. She was also a caregiver as a nurse, and she, filled in that kind of thing. She hated technology. She was a
Mhm.
pen and paper kind of gal, would love to go in there, write it out, and just have a paper record. To her, that was just what computed, right?
Right.
And I think there is a bit of a disparity in caregivers that have been doing it for a long time. Maybe they're a bit elderly and they just don't like technology. Again, I put my mom in that bucket. And I think we're starting to kind of bridge the gap a little bit because technology is getting easier. That's the biggest thing we have heard over the last 10 years is if it's hard to use, they, as caregivers,
Right.
will not use it. They
Right.
want to go back to what they know works and what they trust because they've been doing it for 20, 30
Right.
years,
For
right?
sure.
But now with tech, especially with, I'll use ours as an example, like our caregiver app is just really easy to use. It's
Yeah.
obvious. And I think we have this idea with technology. I'm not saying care smarts, but just in general technology. We think, oh, this can do so many things, or it's complex. Look how like configured it is. Look how many options there are. But honestly, that's not necessarily a good thing. Sometimes less, in fact, in our industry, less is more. The more
Yeah.
simple it is, the more easily it'll be adopted, the more likely it'll be used, and you'll recognize the impact from that a lot quicker. So, yeah, I think, Christina, this has been a fantastic conversation. We can leave it kind of at that. Um, and yeah, I just wanted to say thank you for preparing this time and sharing great insights on your experience as a family caregiver and just your experience in the industry as a whole. Really useful insights for the audience. So thanks to everyone that's now tuning in. And until our next episode, this is Mike signing off with Christina. Thanks, everyone.
Thank you.